today with Dr. Raywat Deonandan, and he is an epidemiologist and associate professor at the University of Ottawa. Hello, Dr. Deonandan. How are you?
Hello, I'm well. How are you?
Good. Listen, on the minds of so many people right now, of course, that flu shot, which Ontarians became eligible for this week. Everybody has been. I know some of the most vulnerable people had it earlier, and COVID. What are you seeing in terms of how Ottawa is reacting to both of these illnesses right now?
Well, we're not really in the thick of flu season yet. That's still coming. And COVID, of course, is highly transmissible at the moment. Across Ontario, we've got about 2,000 cases per day, and number of deaths is holding steady at 20 per day, which is not a good number. So COVID is rough. The big crisis, though, right now is RSV. This virus that affects a lot of children. This is what's clogging our hospitals at the moment and creating this really untenable pediatric hospital crisis, not just in Ottawa, not just in Ontario, but across North America. So we are knee-deep in crisis at the moment.
And when it comes to the little ones, is this expected after what we're coming out of and the fact that COVID obviously has run rampant over the last couple of years? Is this one of the sort of the things that was expected out of the time we've been through?
It's a tough question. So RSV is one of the most common viral illnesses that we acquire in our lives. By the time you're 3 years old, you've been infected a couple of times. What we're seeing now is an enormous wave of respiratory infections, just enormous. That's overwhelming the system. But it's not as big as it was this time last year. And this is an important point. What's happening now is that fraction of people that is having a bad outcome, requiring hospitalization, is larger. And so the hospitalization rate in pediatric hospitals is quite high. Some people are claiming this is due to something called an immunity debt, which is a made-up term that suggests that during the pandemic restrictions, the kids weren't being exposed to viruses, and so their immune systems weren't being primed, and they're feeling the effect of that now. Mm-hmm. I don't think that makes a lot of sense for a couple of reasons. One is that we are seeing the same phenomenon in places like red states in the USA where there were no pandemic restrictions. And two, we saw this huge wave in 2021 as well, so any immunity debt should have been paid off then with interest. What's possibly happening here is the effect of COVID on a lot of people who've become infected in the past few months. It may be an immunocompromising kind of infection. Nobody knows. Nobody knows yet. But it's quite worrying, and I'm hoping that our leaders take some action soon to help alleviate the stresses on our pediatric hospitals.
And when you say leaders take action, are you referring to political leaders in terms of the pressure on the healthcare system?
Yeah, there are many things we can do. Like I wrote an article for Decision a couple of days ago about some of the easy things we can do around buttressing our human resources in hospitals, getting nurses back to work, creating new billing codes for telehealth to keep the ER system a little less busy. But really, we're at the point now where we have to cease demand for services. And that means, hate to say it, bringing back masking in a lot of places. And I'm interested in clean air. So mask and clean air make this problem go away in a few weeks, at least for a while we can fix things. Mm-hmm. But that's a political, third rail right now, masking, unfortunately.
Yeah, so interesting. And as we mentioned, obviously those flu shots have become available to everybody starting on November the 1st. Do you expect a big take-up on those shots?
I didn't a couple of weeks ago. And the government didn't either. They've ordered actually fewer doses than they did last year. Last year the year before we had a huge uptake because of the fear of COVID, but last year the uptake was not as great. So this year, probably somewhere in between. The messaging is not great. People aren't seeing the rationale for the flu vaccine. They think, hey, we've got COVID vaccines, that should cover it. No, the flu vaccine and the COVID vaccine are quite different. The Southern Hemisphere saw a pretty big flu wave, so there's every expectation that we would see one here as well. Mm-hmm. I encourage people to get that flu shot, if for no other reason, to quell and assuage the pressures on the hospital system right now. There's no space in the hospitals. You don't want your grandmother getting the flu and needing a hospital bed and one not being available.
Certainly don't, absolutely. So when you think about all the things that we've been through, are we where we should be? I mean, I know other doctors have said we're in the endemic phase. Are we in the endemic phase?
I mean, that's really a political designation, an administrative term. What it means technically is the reproduction number, that's the average number of new cases produced by an existing case, hovers around 1. And I think we're seeing growth right now, so we're not there locally. And some parts of the world, we probably are there. If we are endemic, it's not a good place to be endemic at this levels. What I'm hoping is that we can, bear through this rough period and get a mucosal vaccine into circulation sometime next year. And there's several being trialed at the moment. A mucosal vaccine hopefully will stop transmission in its tracks. So there's still hope that we can quash COVID. But are we where we thought we would be? We are where we are. It's not a great place to be, but it's where we are. And I think, unfortunately, a lot of the responsibility for managing infection has been downloaded onto individual citizens, and we have to do what we can do.
Dr. Deonandan, when you go to the grocery store, are you wearing a mask?
I am. I wear a mask every time I'm in a public indoor setting. And I have a child in daycare who's not masked in daycare, so I fully expect him to bring home COVID one day. But when I go to pick him up, I wear a mask because we mitigate where we can. Nothing is perfect, but we do what we can.
It's so interesting because I find, I don't know if it's just my perception of it, I find in the last couple of weeks, I've noticed more people publicly wearing a mask.
Good. I think there's good signaling there. And Ottawa in general has higher compliance rates than other places. And one of the problems here is our leaders aren't modeling good behavior. Yeah, masking is voluntary, but it should be highly encouraged. And if we see more public leaders doing so, then we normalize it. It's okay to be the weirdo in the room. It's okay to be the person wearing the mask. It's the right thing to do, frankly.
How are you feeling about the uptake on boosters? I know my daughter and I went to get our boosters on, I believe, Tuesday night. And, it certainly wasn't like it was when we were all desperately trying to get those first shots, for sure. Are you feeling the uptake is coming, or are you still feeling people are reluctant? Like, a lot of my friends only have 2. And they just don't want to get anything else, and it just seems to me, and obviously I'm not the doctor you are, but it seems to me that would have worn off by now.
2 doses aren't enough. 2 doses probably protect most people from the very, very, very worst outcomes, but that's waning. This is at minimum a 3-dose vaccine. We should get vax to the max if we can. I am concerned about the waning uptake. And for no other reason that it signals to the drug companies that there isn't sufficient market for them to develop better vaccines. So what we saw with India, for example, has a mucosal vaccine. And that vaccine was developed in the USA. The developers could not find a drug company in the Western world to take it on because there wasn't sufficient market for it, because they saw how few people are taking boosters at the moment. So this behavior has ramifications for future iterations of better vaccines.
Interesting. I never thought about that perspective. And that's why we like chatting with you. Dr. Deonandan joining us today, epidemiologist and associate professor at the University of Ottawa. I know how busy you are. Thank you so much, Doctor.
My pleasure. Thank you.